Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And today we are checking in with our good friend from a next gen PBM company. We're talking to the CEO of Capital RX, AJ Loiacono. They have just closed a $106 million Series C round led by B Capital. Who else was in there? General Catalyst, Transformation, Edison Partners, all the old investors. This brings our total up to 175 million. So we are going to check in and hear what's going on. But first, let's say hi to AJ. AJ, what's up?
Hey, great to be here, Jessica. I can't believe I was looking at the calendar. It's been about 2 years since we've last had a chance to speak.
2 years, and I remember being so excited to talk to you then. That was like pandemic summer, and it was
Yes.
like we were talking like truly like PBM innovation, trying to figure out a better way to bring people lower cost prescription drugs, and like your model was like brand spanking new at the time, and so it's exciting to catch up with you. And I have to start the conversation off here. I need an update because I'm reading this press release about the Series C. And the thing that struck me was it's like there is all this talk about this tech platform and its IT infrastructure for claims and benefits admin and processing, and being the like delivery mechanism for all sorts of new ways to administer prescription drug benefits. So what's going on, AJ? You guys sound more like a tech company than ever.
Well, I think we always were a technology company, but to be fair, we wanted to study the model before we just started to build the technology. So I think when we last spoke, we were, still working in stealth mode on our platform, affectionately known as Judy. Judy is short for adjudication, and she is the brains behind our organization. And so what we were trying to determine, operating as a PBM, a pharmacy benefit manager, this is us servicing employer groups directly to administrate their prescription benefit plan, was where are the friction points? Like, where's the cost to administer a plan? Because if you think about our model from our prior discussion, we don't make money on fulfillment. So we don't mark up drugs. We have our clearinghouse model, which lets the buyer and seller freely communicate on price, 100% pass through on any drug price or rebate. And really what this does is it creates a much better experience. It creates full alignment clinically, but more importantly, also what it's doing is it creates the same price for everyone. So no one could be like, well, how is it cheaper for them and not for me? And for all the reasons we've discussed in the past. And so when we're studying that model, what you want to look at is, well, where are the friction points to administrate a plan? What costs the most amount of money? And, if you think about it, it starts with everything from even your marketing cycles to your underwriting to implementing a plan and the data exchange and interoperability and connectivity and eligibility feeds and network management and reimbursement and billing and hundreds and hundreds and hundreds of little things. And so what you're trying to figure out is, what can we unify on one platform, and what can we create workflow automation around, which is how can I pull people out of it? Because if you think about it, is if you could reduce administrative cost, you're reducing the price of the prescription ultimately for the plan and the member.
Okay, so talk to me a little bit more about Judy. Like, break this down for me. So, like, explain to me like the technology behind this. So you're taking out, is it like AI that's doing it? Like, what are the things? How are you guys taking out some of the administrative costs? Like, is it just a better understanding of the process, or is it more technical than that?
Well, I think it's a combination of multiple things. So you start with a serverless, scalable, on-demand platform. So you're not paying for compute unless you're using it. And so you're starting with a flexible framework so you could expand infinitely on scale. So it doesn't matter the size of the customer. But what you're looking at next is what I call unification, which is if you think about a traditional legacy PBM or carrier, we hire people from industry and they'll say things like, what I love about the company, one of the things is that I have one login. It's to Judy. I'm not logging into 12 different systems and trying to figure out how they communicate or operate together. So unification was the first thing. Besides building on a scalable platform, it's how do we think about putting all of these workflows on one thing? So if you think about our industry today, we think about electronic claim processing. It's really handling a very narrow layer of what we call plan setup and processing a prescription. And processing a prescription involves, in a very simplistic model, you're at the register at a pharmacy and the pharmacist is on the computer they're communicating through the switch to a different carrier PBM, which is feeding back information and doing drug utilization, clinical reviews, and price checks to provide that information. And that's claim processing. But what we wanted to do is, how do you handle all the manual workflows? Because I often point this out, is why has there been a massive underinvestment in the PBM, or pharmacy benefit administration industry? And just to clarify that point, PBM is servicing employer groups directly. PBA is selling your technology and services to other carriers and health systems for them to administrate their benefit plans. And so what we wanted to do is, again, when we looked at this, is the system just scaled with people. And I make this point because there's never been a bad day in pharmacy benefits. It's an inelastic demand curve where prices endlessly go up. The average cost of a drug continues to increase due to the proliferation of specialty medication and now gene therapies. And so if you never have a bad day in an industry, you don't really think about, how do I innovate or become more efficient? And so the industry really scaled with people on systems that are 20, 30 years old, written in very antiquated languages on old school on-premise racking and cabling. And this is a very inefficient infrastructure. And so what we wanted to do is to take a step back and say, what can I put on a modern enterprise health platform? And so what we looked at was, I want to be able to do my underwriting sequences, my implementation management and onboarding, communication through print and mobile applications, patient portal. I want to manage networks and reimburse those networks, do my APAR functionality of my clients. And these are hundreds and hundreds of tasks that you do. And what you're trying to do is prioritize the ones that are taking an awful lot of time. So something like eligibility, and on the surface may seem quite easy. I'm passing and sending information, but oftentimes to put it in perspective, we connect presently to over 600 unique entities we pass data to every day. So that's everything from carriers to TPAs to stop loss carriers to data warehousing services. And all of these things need to work in concert and securely. And so again, what we did with the Judy platform was, we wanted to automate and connect all of these services and solutions and take down cost. Because, the point I always try and make is, everyone's always focused on what's my purchasing power and, how cheap can you buy the drug? And I'm like, really what you should be asking is, what is the net cost to your plan?
Okay.
Like, I think people have been fooled into and distracted by things that don't matter, when you should be looking at what's the net cost and the net performance. And this is where Judy just continues to amaze us as an organization. I often say we roughly operate maybe 1/7 to 1/8 of the cost of my competitors administratively.
Wow. So, so explain to me the business model here then real quick, AJ, like how has this evolved? Because you explained the difference between a PBA and a PBM. Like, are you guys running a dual model on that? And it's like, if it is a mix, like what's the mix? Because the other thing that I read that I was like, whoa, was this is like amazing, like these statistics about your year-over-year growth from 2019 to 2020, 400%, from 2020 to 2021, 200%. So it's like, which side of the business is growing more here?
So, I like to say they're both growing. I would like to give a little bit of a nod to the PBA side of the business. And to think about it, PBA is, call it a year and a half old for us. It's a relatively new product offering, but the results are very dramatic. We have amazing case studies and partners that are using the Judy platform now, and they've been great brand ambassadors for us in market. And so I would say that the shift is starting to see a little bit of a nudge towards PBA. And I think some of it is because the size of these customers, where the average employer group might be 5,000 or 7,000 lives, which are still big size plans. But when you look at the average health entity, like be it a health system or a health carrier plan, you're often dealing in hundreds of thousands, or as we talk to new customers, even larger, higher targets that we're looking at. And I often make this clear, is that there are no shortcuts in healthcare. So when you and I were talking 2 years ago, first of all, I'm happy with any sized account. I love clients. So 300 life plan, sure, come speak with us. I'd love to service you. But I think what I always point about is your trust score in healthcare, which is, a lot of people start healthcare companies and they're like, my brother-in-law this, my friend in this company, my uncle's the CEO of this Fortune 100 company, and we're going to land that tomorrow. And I'm like, I've been around the block for 20 plus years in this industry at this point. There's no shortcuts. You go to a Fortune 50 company, you know what the first thing a Fortune 50 company is going to ask? What other Fortune 50 company can I speak with that you service? So I often talk about your trust score. So you start selling 1,000 life cases to get to 2,000 life cases, to get to 4 and 8 and 16 and 32, and you start to build up your reputation. And this takes time. It takes years. So, we're in our 5th year of operation now. It's hard to believe. And now we have the ability literally to service any sized client. So, my smallest customer, I think, might be a couple hundred lives. My largest account may be pushing 500,000. And so when you think about that, you have the capability to service not just size, but the other thing I want to point out that's unique to our platform is line of business. So we're able to process both commercial claims as well as government claims, Medicare and Medicaid. And this is a very big differentiator. So really, when you have our Judy platform, you could service literally any size customer in any business segment in pharmacy. And that's proven to be extremely helpful when we talk with customers.
That's awesome. So, I mean, I have to ask about the market writ large then. So it's like, I mean, the big three, you've got, Express Scripts,
Sure.
OptumRx, CVS Caremark, notorious for having control over 3/4 of the market. Do you feel like you're starting to make headway? I mean, I feel like there's been a lot more elbowing in on the incumbents in not only the PBM space, but also in just the health plan payment space in general. I think this is something I've got my eye on. It's like a conspiracy theory, maybe, I don't know, or just maybe it's the disruptive people I'm talking to. But do you feel like there's been, I mean, among the clients that you're talking to, I mean, they're looking for something different other than those as options, right?
Well, I think we're definitely making progress. And I think even in the early years, statistically, if you think about it, 90% of our book of business today came from one of the big three. So our business comes from them. Now, some of it, statistically speaking, in certain markets, they probably are 80%. So 80% of the time, if you're going to remove an account from someone else, another vendor, it's going to be one of the big three. But 90% of our book comes from the big three. In addition, we're starting to go up market. So on some of the health plans, some that have been announced, some that we're announcing, we're pulling from the big three. And I think there's a couple different reasons why. Like when we win an account in a health plan, what the feedback you get is, the first one is innovation. They're blown away by Judy and our capabilities and how seamless and easy it is to administrate and manage these plans. And if you think about a health plan, is they're really an entity that could sit on hundreds or thousands of sub accounts. So efficiency and administrative excellence is very important to them. I think the other thing that we look at when we kind of go through the model and you say, wow, like the evolution of this and how you've moved in and why these people are moving to you, I think the next thing that comes up is there's no conflict of interest. And this is an interesting one, where once upon a time, the big three of PBM had names like, Caremark, Express Scripts, and Catamaran. And why I mention this is they didn't own medical assets. They weren't medical carriers and pharmacy carriers. And so there was no conflict of interest. They could service, a health insurance company and be like, hey, I don't compete with you in market. But now fast forward today, these are all vertically integrated entities known as Cigna, CVS, and United. And so they compete with everyone in every market and every line of business. And so there's an inherent conflict of interest. And it doesn't matter if it's the same story of like, well, you may not be getting the best rates or the best outcomes the way I am. I think people are starting to become a little bit sick and tired of that story. And so I think that's a huge differentiator. And I think also we're very forward looking, which is, what do we do next? How do we help them continue to evolve and advance? And I think this is what has been proven to be a very potent combination for us in our growth.
All right. So speaking of what's next, let's chat there for a minute. So 106 million. I mean, that's a lot of capital. So what are you guys going to do next? I mean, do you continue to blow out the tech platform side of things, the PBA side of things, or do you continue to layer those services on top of it and grow the PBM side of the business? Is it both? I mean, tell me a little bit about what the plans are for the capital.
Sure. So the first thing you want, obviously, when you raise capital for the use of proceeds is to continue to support the existing model and the existing solutions. And it's not just to support the growth. I often joke, like we wrote up a payment module like a year ago, and we crumpled it up and threw it on the floor, this year and said, start over. Like, because even the observations we made from 2 or 3 years ago were okay, but operating at larger scale with more lines of business over time, we recognize we need to make improvements. So part of the proceeds is to continue to support the business, both in growth as well as administrative and from a technology standpoint. The other area that we look at from an investment is R&D. So we spend probably 30 to 40% of our operating budget on R&D. And that's a lot of money. And the reason why is there are so many things that need to be fixed in the infrastructure of healthcare. And I often make this point. This is a good way to visualize what I see. So think of it this way. In the United States, I believe there are two electronic processing workflows in the United States for healthcare. One, it's EHR, electronic health records, however you want to look at that, which is really the workflow to activate a claim. It's patient records, it's decision support, I'm prescribing something, you're having a procedure done. But the moment a physician, completes a procedure or prescribes a medication, you've given like life to a claim. You have this claim, and now the claim disappears from EHR and it goes to my world, which is the administrative workflow of a claim. So this is the electronic workflow to administrate a claim. And this is what we call an enterprise health platform that we've created. And what's interesting is this is the workflow of, are you a network? What's your plan design? What's your co-payment? Am I eligible in this process? What's my payment, reimbursement, clinical oversight, et cetera? All of these things are being done. And there's been really no investment on this side. And I would often challenge that the world of electronic health records, EHR, versus an enterprise health platform, the enterprise health platform is much larger. And what we're looking at is there's been this really an underinvestment, and this is a huge opportunity to improve on these workflows because there's a lot of promises of vertical integration, creating efficiency, and perhaps it's some sort of value-based contracting or care. You can't execute on these promises in the existing administrative workflows and infrastructure we have in the United States today. Systems do not speak to each other. They're antiquated. It's a slideshow of information, and you're really not doing any service to either the patient or the plan. And so part of our R&D is to improve all of these workflows, not just what we touch today, but if you think about it, my customer is a payer. A payer could be an employer group, it could be a municipality, it could be a state-run program like Medicaid, the federal government, a health plan. Those are payers in the United States. And my whole point is they need to become more efficient, safer, and focus on better outcomes. And to do these things, they require an entirely new infrastructure. So I often say Capital RX, we're the best plumbers in healthcare. All the things you don't see, these are eligibility file feeds and accumulators and data exchange and managing networks and reimbursement and payment and all these workflows that go on in the background, even mundane things like printing cards and communications and letters. All of these things need to be coordinated and integrated, oftentimes with multiple vendors. And so we handle these workflows to maximum efficiency to reduce costs. And in this turn, you provide a better benefit.
Are you out of pharmacy then and into more general healthcare? Does this put you into a whole different world then, ultimately?
Well, I think for us, our roots are pharmacy because there are two main benefits. There's medical and pharmacy when it comes to healthcare in the United States. Our roots are, as we discussed, PBM and PBA. But I look at, going forward, a claim is a claim is a claim.
Okay.
And what I think is more important is you have a plan, you have a patient, and you have information about access to care, communication on when a patient needs care or checkups or information, and the payment workflows. And oftentimes we're paying the same people or reimbursing the same people. It doesn't matter if it's medical or pharmacy. And so for us, I look at the future and I say unified claim processing, in a hyper efficient infrastructure is the future of healthcare.
I like that. And I mean, honestly, I'm glad that we arrived to here. I mean, I love these infrastructure plays. And I feel like, and not just you, AJ, but it's like a lot of the tech companies that I've spoken to over the last couple of years have evolved their model to think a little bit bigger and really think about how they can take the tech that they've built for, one piece of the market and really apply that to become really that infrastructure for the whole thing to run on. So I can't imagine what the interview we're going to have in 2 years from now is going to be like. You're going to evolve your model again.
Well, I think it's a natural evolution. I always say we stay with the same vertical. It's a payer. I want to service the payer's need on healthcare. In any way that I can lean in and provide both technology, service, and support, I'll do it. And so that's what we're very focused on. I do say we stay in our lane, which is I'm not going to jump into lab anytime soon or dental or vision or things like that. But I think what we always look at is kind of the primary workflows around administration, network management, payment. These are characteristics that are shared with every payer and every benefit or service they're providing. And so, today we're hyper focused on our PBM and PBA growth, but this foundation, I think, will lend itself to a lot of areas that we're partnering. I often say, some of our best product managers are our customers, where they say, you do an amazing job with this. Could you tackle this? So we've got a bunch of pilots we're kicking off next year with some of our key customers. And again, we continue to expand the services that we provide these payers.
All right, AJ. Well, we are going to have to keep our eye on what you guys do next. I'm so excited that we had the opportunity to catch up. It's been a busy 2 years. I'm excited to see where you guys have come, and congratulations again on your Series C round. Great investors in there. A lot of them coming back, and the future looks bright. I think this focus on your technology is really exciting. It's very exciting for me to hear about and how you're planning to deploy it even further moving forward. Yeah, very cool stuff.
Thank you so much, Jessica.
All right, we'll talk to you soon, AJ. Sooner than 2 years, okay? I don't need another big fundraise here to talk to you. We like to hear what's happening on the PBM-PBA side of things.
Anytime.
All right, awesome. Well, thank you so much for joining us. I'm Jessica DeMassa, and for more interviews with folks like AJ who are changing the way that we do healthcare, head on over to my YouTube channel. It is youtube.com/WTF Health. We'll talk to you guys real soon. Take care.
Thanks, Jessica.